Good morning, ladies. How are you?
Thanks. We're good,
Very
thank you.
good.
Morning.
Morning.
So I am quite excited about today's episode. We are continuing with infertility, but today we're tackling the more emotional aspects of it. We're going to answer the two questions that were sent to us, and let's kick off. Okay, so infertility, right? It's a huge topic. So how do we deal with people asking questions about babies, right? We're talking about the emotional aspect of having lost a child or having had a miscarriage. We're talking about the emotional aspects of now you've been married for a while, you don't have children, and people keep asking you, your in laws are asking you, your married friends who are on baby number 5 are asking you. And we're also talking secondary infertility. And if my memory serves me well, secondary infertility, wow. Infertility, sorry about that. I'm still waking up. Secondary infertility is when you do have a child or children, but then you're trying and nothing happens. So we're also talking, to those women who you do have one child and you keep getting questions about when the next one is coming, not for a lack of trying, but because there's something happening. So who wants to kick off?
I would like to go.
Sure.
We received a few questions as well. I don't know if you guys want to address them now or later after we dive into infertility.
Maybe we should address them first because they are more medical and less on the emotional aspects. So should I?
Yeah, I'm worried that when we go through the emotional, we won't get back to this. Yeah, so you can read them out to
Okay,
us.
sure. So the first question, because miscarriages are real, I wasn't ready for a child, but the miscarriage has always stayed with me. More than anything, can I have a healthy pregnancy after the hectic cervical cancer scare? So I think this question is more around, can she fall pregnant and have a healthy pregnancy after having had a cervical cancer diagnosis?
Okay, so that particular question, I actually know the lady, and she had a cervical cancer scare, as she noted. And, with cervical cancer, so with a pap smear diagnosis of query cervical cancer, we actually take a biopsy of your cervix. So I suppose she's worried that, after now the cervix, some of it is gone. Can she still pregnant? Can she still fall pregnant, first of all? And can she keep a baby in the womb, for lack of a better word, for 9 months? And absolutely she can. And also after having had a miscarriage, that has no bearing on the next pregnancy. Actually, basically in the medical world, we say you're allowed to have one miscarriage without us getting worried, because most women actually have miscarriages. They may have miscarriage so early that they don't know that they were even pregnant, so they think it's their period. But you're actually allowed one miscarriage before we start, panicking about what future pregnancies would look like. So absolutely, she can have another pregnancy based on the miscarriage, and she can have another pregnancy even with the cervical cancer scare.
Okay. Okay, well, I suppose that's good news for her. And I hope she's watching and she got her question answered. The next question. I had a molar pregnancy. Sorry.
Can I just hop in there, Randy? I think if you can maybe, because you address something now regarding how most women will miscarriage that they don't even know about because it happens so early, that it's maybe undiagnosed. What I wanted you to please advise the women that are watching that when should they seek medical, to how many miscarriages? I know in the government, there's a certain number. I think most hospitals will say if the patient has had 3 miscarriages, only do they qualify to be seen at the infertility clinic, simply because the resources are many, but the resources are few. But can we please just delve into that? Let's advise the patients that have medical aid that are able to, and those who would be going via the clinic system to to a secondary or tertiary hospital, when to seek help and when would they qualify for certain.
See, your network has gone unstable. It's chopping out quite a significant number of your words.
Okay, let me just see. I see what's happened there. Am I back?
Yes, you're right.
Oh, yeah. Sorry about that. Should I ask the question again?
Let me see if I could make out your question. So, Rendani, I think what Busi's asking is, how do we advise women who have had multiple miscarriages as to when do you seek help? I think she said that in government, you after 3 miscarriages, you qualify to go for the infertility treatment. So with private patients, how does that work?
Okay, so this is a very broad topic, but I'll try and just, give you a quick sort of summary. So if you've had first trimester miscarriages, so it depends, if it's first trimester, second trimester miscarriages. So there's 2 different ways of dealing with both. So first trimester is before 12 weeks, and then second trimester is from 12 weeks upwards. So if you've had 1 first trimester miscarriage, we won't work you up, whether in private or in government. Generally we won't worry about that. But if you've had 2 miscarriages first trimester miscarriages in private, they'll start working you up and try to figure out what happened, what was wrong, was it something genetically wrong with the baby, or was it something in your womb? Maybe you've got fibroids or something like that, right? And if it's a second trimester miscarriage, even 1 is too much. So with that, we start working you up, whether in government or private. We start working you up, see if your cervical length is long enough or not, and if you need to have something called a stitch. Basically, it's a stitch to close your womb, because mostly what happens in the second trimester is that your womb is not able to hold the baby. So that's when, and people who've had one second trimester miscarriage need to actually just go in as quickly as they fall pregnant the next time, so that we know how to handle that pregnancy. So they don't even wait until, how people book a bit later. You don't even wait for booking a bit later. As soon as you miss your period, you go in, whether private or government, to get assessed for that.
Okay. Can I read the next question?
Yep.
Sure.
I had a molar pregnancy, and it was the first time I heard of it when I had it. Can the gynaes please address this? I'm looking forward to the next episode. It hits close to home with my PCOS and infertility journey. So what is a molar pregnancy? And
another broad topic.
So tell us what molar pregnancy is, and also what is PCOS, and how does that affect fertility?
Okay, so a molar pregnancy is basically something genetically wrong with the pregnancy. So it's in the way the sperm fertilizes the egg, or the way that the egg divides after that. And it's such a broad topic, it's difficult for me to explain, but basically it can cause even cancer eventually, if, depending on how the genes have mixed and what has happened with that pregnancy. So if you a molar pregnancy, you'll hear a lot of I think patients. I'm trying to remember how they refer to it. They'll say that there's no embryo inside the egg. So basically, when we scan, what we will find is that it's just a circle and there's nothing inside it.
Sure.
In the medical world, the term is called an embryonic pregnancy, but sometimes you may find that there is, contents in there, but the wrong kind of mixture, which causes a sequence of events that can become cancerous. So it's quite important to detect it early and fix it early.
How early can it be detected, and when is it too late?
So it can be detected within your first missed period, as any other pregnancy.
Right.
And then there's no such thing as it's too late, as I'm saying, because it just depends on how the genes mixed. So not every molar pregnancy is going to be cancerous, but some can be.
So can I assume that if you carry a molar pregnancy to term, what is my assumption? So maybe let me ask it as a question. What happens, can you carry a molar pregnancy to term? And if so, what then happens?
I would say in my personal experience that I haven't seen it myself.
Okay.
There are partial molar pregnancies. That's why I'm saying it's such a huge topic. There's something called a partial molar pregnancy,
Right.
where there actually is a fetus and there is also these abnormal processes going on in your womb as well. And it becomes quite a difficult pregnancy to manage. Patients often bleed a lot and things like that, and they often have very difficult to manage symptoms.
Right. But they can give birth to a healthy baby, can they? No?
Well, after the molar pregnancy, they can get pregnant again and have a normal pregnancy. Yes.
Right. Okay. Part 2 of that question is PCOS. What is PCOS and how does it affect fertility? Does it affect fertility? What do we need to know about that?
PCOS.
Is it another big topic?
Another minefield of infertility. It's called polycystic ovarian syndrome. So basically, you know that we need eggs to produce babies. So with polycystic ovarian syndrome, you have too many follicles forming together, and it causes hormones to basically misfunction. So you have insulin resistance. You actually have a difficulty releasing one viable egg for you to be able to fall pregnant because you have all these eggs forming. Generally, per month, you release one egg that will be able to go into, the fertility journey.
Right.
So with PCOS, sometimes you're not able. I'm not saying all the time. People with PCOS fall pregnant all the time. It's not impossible. But it becomes just a bit more of a difficult journey because of the hormonal impact that all of this has. Your estrogen gets affected, your luteinizing hormone gets affected, your sugar gets affected. It's a lot of things that get affected, but it doesn't mean that you're not able to get pregnant.
Okay. And then I have one more question. What is is it ectopic? What is it? Ectopic. Yes. What is an ectopic pregnancy, and is it linked to infertility?
That's a good question. So an ectopic pregnancy is a pregnancy that happens outside of the womb, anywhere outside of the womb. So it can happen on your tubes, it can happen in the abdomen, it can happen in your cervix. So any pregnancy that doesn't actually fertilize inside the womb, so it doesn't implant in the womb, is called an ectopic pregnancy. And generally, you can't. It's a difficult one. Some people do get to term with ectopic pregnancies, which are abdominal pregnancies, but it's incredibly, incredibly dangerous. And then most people with your tubal ectopics, they don't get to term because then medical problems happen. So you basically have a rupture of the tube or something like that. As the baby grows, it becomes impossible to keep the pregnancy. So how it can affect fertility is, let's say the tube one, that's the most common one. If you've had a left-sided ectopic and we took out your tube before, and you have another ectopic on your right side, then it does affect fertility. But what most women do then is go for IVF because they can still fall pregnant. It's just that they don't have the tubes to be able to fall pregnant. But if you've had one ectopic pregnancy and only one tube was taken out, many women go on to have 4 or 5 babies after that. So you can reproduce with just one tube.
Okay. Sure. Thank you, Rendani, for answering all those questions. What are your thoughts, ladies, based on what we've just heard? And I'm so aware that today's episode will be a bit longer than it normally is, for already 50 minutes, but that is fine. But what are your thoughts on what we've heard so far before we go into the emotional side? I think it's quite a broad, infertility is quite broad, and I think with every aspect of it comes a lot of emotional distress, irrespective of what type of infertility or how it's affecting you. It's quite distressful.
Yeah.
I think Busi is frozen. Sorry, Kim.
No, so the thing is, my thoughts is that I'm just thinking that we as doctors are trained to know all the abnormalities that could possibly happen. But yet a woman only finds out about this when she is struggling to fall pregnant or finally falls pregnant and now gets to be told that it's abnormal and we have to do this. And most of the time they become somewhat medical emergencies. So you're not even given time to go home and process things. It's like, you know what, you have an ectopic pregnancy. We must take you to theater now. We don't know what we're going to find. If we can spare the tube, we will. If we can't. And so it usually becomes such a very emergent thing to do. And most people tend to process things thereafter. And so that's what I am learning is that, it could be easier for us when we are going through it, but I can imagine how difficult it is for a woman who is struggling with either falling pregnant or having miscarriages or having abnormal pregnancies. And another thing is that it's very important that we monitor our periods and seek help immediately, because we tend to see people coming to antenatal care and then they are 4 months pregnant. And yet the most important time is the first trimester. Hey?
Right.
And then you find that somebody has not changed their habits. They've been drinking a lot of alcohol. They've been smoking. And by the time they find out they're pregnant, the embryo has sort of like developed. And if there were any abnormalities, it could be permanent now. In psychiatry is that some of our medication can harm the baby. And so it's very important that we know within the first trimester that somebody is pregnant and see what we can do if we need to adjust any medication. And so it's to encourage ladies to seek antenatal care whenever they find that they're pregnant, or to do a home pregnancy test when they've missed a period and not ignore, say, you know what, these things happen, because maybe if there are stuff, it could have been intervened earlier on. So yeah, from what Randy has spoken about, I thought that's what I could pick up. Yeah.
So it looks like Busi's having network difficulties. So Randani, I'll bring this question back to you. So, Clementine is talking about how we don't monitor our periods, right? And I have heard of women who didn't know they were pregnant because they kept seeing their period. What is that? What do we call that, right? And how common is that? We've lost Busi. Hopefully she'll be able to join back. But Randy, that's my question. With the whole I didn't know I was pregnant. I mean, there's a whole show. I didn't know I was pregnant. Yeah.
I still think God is God.
Mm-hmm.
And that one is like, I wouldn't say it's very common, but it happens. And it happens. And I actually believe those women that are like, my period was coming. I didn't know I was pregnant, and there's something called basically where your placenta is makes you be able to feel the baby's movements a lot more than someone else. And also like things like high BMI. So if you're very big and so on, it might be a bit more difficult for you to feel fetal movements than not. Because I've met so many women where I'm just like, you didn't know. Okay, fine, your periods were coming, but your baby moves. You can't feel that there's a whole entire being moving. And yeah, sometimes women have anterior placentas and it's a bit difficult for them to feel the baby move. I mean, even me, I had Otonwa and he didn't move as much as what textbooks talk about.
Right.
So that's even more of a personal experience. I knew he was there, I knew he was fine, but in terms of medical, terms or whatever, he didn't move as of the way that women generally move. You'll see women making videos of their stomachs moving and you can see this visual like movement, and I know definitely that Otombo was not moving like that. So if you have a higher BMI and stuff, it might be more difficult to feel that.
Right. I actually, I also have a question based on my personal experience with my pregnancy. I think I found out I was pregnant at around 5 weeks, but then I had taken 4 pregnancy tests and all of them were negative. The only thing that made me go to the doctor is I had the most ridiculous exhaustion. I thought my organs were shutting down. The last thing I thought was I was pregnant. And only the blood test indicated that I was pregnant. So, how does that happen? So we're talking about I didn't know I was pregnant. I took 4 tests. They were all negative. What causes that? Different brands, might I add.
So what causes that is that the fact that, it's another broad question, but I'll try and summarize it.
Right.
Basically, when you have your period, right? We all think we have our periods every 28 days, or we have a cycle of a period, right? But as Clem is saying, we don't really monitor exactly when the 28th or the 26th or whatever it is cycle. So you're not sure when you actually ovulated.
Right.
You might have ovulated a bit later than what you thought. Yes, sure, you just missed your period, but it might be because the pregnancy is only happening then. It's only starting to form then. So there's not enough hormone to be picked up in your, in your urine test. And then that's why then we revert to a blood test to try and pick up this hormone. It might be that, or it might be that the hormone for you picks up a bit slower than other people. I know with textbooks or whatever, it will say that the hormone, it's called beta HCG, it needs to double every 48 hours. Can I tell you that in my personal experience, it did not double every 48 hours. And there's a baby somewhere, somehow. He's not a baby anymore. He's 4, as he tells me all the time. But he exists, So that's why I'm saying God is still God above all of these medical tests and stuff. But most commonly, it's more that you ovulated a little bit later than what you thought you ovulated, because we're all not, as Clem is saying, we don't really take cognizant of when our period was, And yeah, I think when you're trying to fall pregnant, obviously you're much more aware of when your period was, when your cycle is, and whatever. But generally, we're not counting. So the ovulation might not take place when you think it did.
Okay. Right. So thank you, Rendani. Busi, do you want to add anything before we move on to the more emotional?
I'm not sure if I'm going to be able to. I don't think I'm audible.
You are, and you're clear. Your picture perfect. We can hear you.
Oh, you can hear me now.
Yeah.
Okay. Yeah. I just got a bit thrown off. It's fine. I'll listen in and I'll pop in some way. Let me just find myself again.
Okay. So can we talk about secondary infertility and the emotional aspects that come with that, right? So not just struggling as a woman to fall pregnant again, wondering, I've got a child, here's proof that I can have a child, what is happening now? So that emotional experience, but also the world and people's comments and people's questions and all the pressure that comes with that. What are your thoughts, ladies?
Can I go first?
Sure.
I've been talking so with my own personal experience, I mean, over the past 4 years, basically almost as soon as Otondo was born, people were asking, when's the second one? You're getting too old, you're this, you're that, and it's a bit difficult to navigate those waters because in your mind, it's either first, I mean, initially I didn't want a baby again. I was just trying to get used to being a mother, which was just a minefield on its own, trying to be a mom, a career woman, all this stuff. And then you're trying to also just figure yourself out as a mother. Initially, I didn't want to be a mom again. And then a year or 2 years later, I started trying again, had 2 miscarriages, and people and their comments just don't stop. And it's quite, so for me personally, I think a lot of women would feel pressure. For me, I don't really get pressurized by people, but I get irritated as to stay out of my womb. Are you going to help me take care of this child? First of all, like, when people are just like, yeah, your time is running out and stuff and whatever. Who's paying for school fees?
Right.
Right. Like,
yeah.
Are you going to help me? So why are you so concerned about my life? Like, I just get annoyed more than anything else. I'm just like, why are you so concerned about my life? Like, it's not, I feel like people think they're doing it for your well-being and whatever, but at the same time, who are we to prescribe to other people what they should and shouldn't do with their lives? Because that sort of has a God complex of, you think you know what's right for me, and how does that work, So yeah, that's just my personal experience. I don't like it. Don't ask me. We're not doing this together. Like, don't do it. If you want your own safety, don't do it.
Really? You sound like you need some therapy on that.
Possibly. I just don't like it. Like, why are we pressurizing women so much? Like, women are prescribed to in everything. What to wear, what to not wear, how to act, how to not act.
Right.
Like, everybody has an opinion about how we should do things. And with the pregnancy one, I think it's a bit more difficult because it's almost like we've been taught that our identity is linked to that. So now imagine going through operations and having miscarriages like I've had, and these operations, and you're sitting on a hospital bed, and someone, I don't know, they're sitting at a home or whatever, and they decide that that day is a good day for them to ask you, when are you having the second one? They don't know that you are going through so much hell. I've actually had that. I had an operation. I had just had my miscarriage, and someone sent me a message and said, "Oh yeah, by the way, I was thinking about you. When is the second one coming?" I have never had so much anguish in my life. Like, I felt like I'm going through the most already.
Yeah.
And sure, you're having a good day somewhere or whatever, but you don't know that I've actually bled through my pregnancy right now. You don't know that, and it's kind of just it's a difficult thing. And I feel like because our identity are linked to being able to have a baby or not, it's even harder than being prescribed to as to how to run your household or how to, what shorts or not shorts to wear or whatever. It's even a more difficult thing. And I feel like for some people, it can push them into depression and trying to take their own lives and whatever. So it's easier if you just don't say anything unless someone says to you, I need support from you. Don't ask anyone when are they having their second baby, because they're actually aware. I'm quite sure most women are aware whether they have children or not. So to be asked by an external person, when are you doing it, it's a bit of an unfair question.
Yeah. Speaking of depression, Clementine, this question is for you, right? So if you are a woman who is going through fertility treatment or trying to have a child, and you're depressed and you're on medication, or you do fall pregnant, but you were already on antidepressants, or you pick up depression during the pregnancy. How do we treat that? Can we treat women who are navigating those spaces?
Yeah. Okay, so it is, like Randall has been saying, a broad question. It's not a one blanket to all, So, so depression can be one chemical imbalance, but also it can be because of what you're going through. So you are stuck in the process of falling pregnant, and it's just affecting your self-esteem, it's affecting your ability to sleep, it's making you question. A lot of women tend to internalize, so if there's something wrong with me, and they try to go back into their life. Which sin did I commit? Which person did I hurt? Which neighbor did I offend? Are they trying to bewitch me? Is it a spiritual attack? And all that conflict can cause someone to just feel helpless, and therefore depression sets in. And yes, it can set in at any time of the pregnancy. And so, the discussion around medication also depends on how severe the depression is. Most leaflets will say that, safety in pregnancy is not established, and so if we can, if it's mild depression and you can get better with just psychotherapy, then we might stop antidepressant, especially in the first trimester. But if somebody is so dysfunctional and suicidal, and they have actually the risk of them succumbing to the pressure of depression is higher than them not taking antidepressants. So we might have to put them on antidepressants and monitor them, but would have to discuss the risk factors to the fetus. So it's sometimes not a very easy decision to make. And so we try and deal it with one patient to another. But like I'm saying, that the most important time is the first trimester. So after the first trimester, you can be put on antidepressants. They don't necessarily have scientific teratogenic effect, like some medication, like if you're on Epiline because you are bipolar, that one we know that can cause spinal bifida and things like that, neurological problems. And so those ones we don't even try and put patients on medication, especially during the first trimester. But yeah, it is possible to develop depression in any time of your pregnancy. And one of the things is that people usually develop postpartum depression, right? And it's very, very common, and it's very subtle. I think I personally had postpartum depression because I remember just feeling overly overwhelmed, and I would justify it with, what, I'm just a new mom, it is normal, it's a hormonal change. Like I would scientifically try to accommodate it, but by default, I ended up taking something to help with the breast milk, and it's actually a tranquilizer, an antipsychotic, or an antidepressant. And I remember after 3 days of taking that, I started feeling like, oh, I'm feeling more like myself again. And so in retrospect, I was like, I think I had postpartum depression, but I really thought it was going to be this big thing that is going to make me feel so suicidal and stuff. But I just remember just feeling just overwhelmed and crying every time my baby cried, not knowing what is it that I'm supposed to do. So the second pregnancy, I didn't play around. I just went and sorted myself out, and I had a big postpartum period, So those are the things that most women, I believe, they are struggling with, the postpartum depression. So
yeah.
Yeah.
Sure. As I'm sitting and I'm listening to you ladies, I'm like, this is actually such an emotionally intense experience, from trying to fall pregnant, falling pregnant, and worrying about the pregnancy for the whole 9 months, praying for a healthy baby. So now you have given birth, and now this postnatal depression. I think it's actually, yeah, it's quite intense.
It's a lot.
It's a
Really
lot.
a lot.
It's a lot.
And I think women that have struggled with infertility and now have fallen pregnant, their anxiety is even sky high. Like it's through the roof because they're just thinking can I actually take this baby to term, And I think, imagine like someone who's had infertility or whatever, and they finally have their first baby, postpartum as well, must be such a strain, because finally the anxiety of, can I actually have this baby at term? And then they have the baby, it's like, now can I keep this baby alive? Like, I think women that struggle with infertility have it even way more like worse. It must be so nerve-wracking.
Absolutely. Lucy, do you have any thoughts?
I have so many thoughts, but I've actually missed the show. So I think next time, I think today I was here for the moral support. Next time when we chat, then I'll come in with everything else that I had to say.
Right. Okay, so I am thinking, because we don't want our episodes to be too long, because this topic we can literally just go in. I know I had said that today we're going to talk about the emotional aspects of loss, of miscarriages, and all of that. But just judging from how one question turns into a whole topic, I vote that we actually have a special episode on loss. What are your thoughts, ladies?
I'm straight up, definitely. 100%. I'm in agreement.
Yes. Do we have any final thoughts from everyone? I think this was incredible. And I just, let me be the first to share my thought. I think for me, what has really stood out for me is that from thinking about falling pregnant to actually going through the process, whatever the process looks like for you, whether it's the natural way of falling pregnant, or whether you need assistance via IVF, and to actually conceiving and carrying the pregnancy through, and even after giving birth. I think for me, what has become crystal clear is the importance of having God in the entire process, right? Because I personally know of women who had harvested, not harvested, is it harvested my terminology, but when they take out your eggs, and they had like 8 viable eggs, which turned out to not be viable. That's a huge loss, right? Because and I think it's also a very expensive exercise. But I think for me, it's so clear how, for me personally, to have God through the entire process, whether it's for conception, or whether it's even to help you give, peace that surpasses all understanding when pregnancy doesn't happen the way you thought or that you wanted it to happen.
Yeah, I think that's great. You absolutely need God, just because of the amount of stress that goes, as you're saying, preconception. Now you've conceived. Can you do this? And afterwards as well. Like, you absolutely need God to carry you through.
Yeah.
The truth of the matter is, He is the creator. He created mankind in His image. Genesis chapter 1. In His image, He created male and female and all mankind. So the only thing that makes sense to me is to depend on the creator to carry us through as vessels that carry other creation. Because when we give birth to children, we become carriers of human beings, of mankind, men and female. So who better knows our bodies than God Himself, than the King of the universe Himself? On that aspect, I really just want to leave it at just for today, as I've said, I know I've already missed out. In everything, we need to seek the guidance of the Lord, I think, from the beginning. We know when we want children. I do believe that God has to be a part of that prayer and part of that decision, because even if you look at things from the medical point of view, a big percentage of miscarriages are because of congenital abnormalities, right? So genes gone wrong, right? Those are things that happen early. That's perversion of the seed itself, So when we involve God and we ask Him to be in control from the beginning, then I do believe that that is the best way. I'm not saying if anybody had, I don't know, a fetal anomaly or anything gone wrong in pregnancy, it's because they didn't pray. I'm not saying that at all. I've also had a miscarriage before, and I didn't blame God. I just understood that there are times and that there are seasons. There are seasons to cry and there are seasons to laugh. There are seasons to mourn and there are seasons to rejoice. And what we go through in the end of the day, at the end of the day, depending on how you take it, should mold you and should not break you. I do believe we have a choice, but that is another story for another day. So what I'm saying today is let's pray from the beginning, from before conception till delivery, and even when the children are there and blessing us. Children are a heritage from the Lord. So that's all I have to say today. Thank you, lady.
And Clementine, your final closing thoughts?
Yeah. The thing is, we as women might think that, having a child is easy. You just have sex and you conceive. But, science have shown that it's actually not as easy. And that if you are struggling with it, know that you're not the only one who's going through it, even though you are the one who's sitting, across the table of somebody who's telling you that it's going to be difficult for you. You're not the only one. And we're here to help and work with you. And so it's always to try to reach out. It's always to try to speak to people. It's always trying to even correct people who sometimes can be insensitive about things like that. Like, you know what? I am really struggling with conception. And so, just be sensitive around asking me when am I having another child, because sometimes to just keep quiet and nothing gets to change. So let us be kind to ourselves and let us be kind to one another. And life is hard, and don't walk alone. Just find people that you can pray with, that you can fellowship with. People can encourage you, and people can give you facts, because it sounds like a lot of people have gone through some difficult stuff as well, but those concepts were not explained in details when they were going through those times. And so, it's okay to ask your doctor, what is molar pregnancy? What is ectopic pregnancy? Especially when you are going through it. If you don't ask, sometimes we are busy and may not necessarily sit down and explain things to you. But if you ask, I think everybody is willing to engage you in that. So yeah, those are my thoughts. Thank you.
This was incredible. Thank you so much, ladies, for another authentic, another biblically sound, emotionally and medically sound episode. So, as agreed, our next episode, we will be talking to you about the loss that comes with infertility and miscarriages and even losing a child. Thank you to you, our viewers. Please subscribe and share with your friends, share with your partners, share with your siblings. Thank you, ladies. We will see you in 2 weeks. Bye.
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 Thank you.
Bye.